Here's a look at your... With healthcare costs continually climbing, staying healthy is a goal for most Americans. Mary Ruth's guest this morning has an unusual method of improving your health. Mary Ruth?
John, this morning we're going to hear about health care for the 90s and how Dr. Timothy Francis says you can improve your health and solve some common problems. He joins us in the studio, and he's an applied kinesiologist. Did I say that right?
Yes, you did.
What is that all about? What we're talking about?
Applied kinesiology is basically using muscle testing as functional neurology to determine what's wrong with the body and what we can do about it.
Okay, now I don't understand what that means, so tell me in layman's term what that means.
We test various muscles of the body in conjunction with traditional diagnostic tests in order to help us determine the correct diagnosis on the patient and what we can do to balance the body.
How does one go about balancing the body? Is that a chiropractic thing or what exactly?
Balancing the body involves not only chiropractic but also nutrition, needleless acupuncture, and various reflex work, as well as working with craniosacral mechanism.
What's craniosacral mechanism? What is that?
The craniosacral mechanism is basically the skull moves with respiration, just sort of like your rib cage moves with respiration. And sometimes that can get out of sync with the rest of the body.
And is that what gives you some of the ailments you have? I know some of the things you list are allergies and headaches and TMJ and things like that.
Correct. Basically, that's imbalances in the body, either structural, chemical, or emotional imbalances.
So somebody comes in and they're having problems with pain. What is the process that you put them through?
Basically, we do a very thorough history. We do the traditional orthopedic neurologic tests. In addition to that, a complete applied kinesiology test, which involves a complete postural analysis, muscle testing. There's about 650 muscles in the body, along with other tests.
And then what do? They put this person on a program? Is that what you do?
It depends really on the patient. We have patients that fly in to see us from Hawaii, from Arizona, California, and it depends really upon the needs of the patient.
Now, is this a common practice, or is this something new? Is this a new age thing that we are hearing about these days?
Applied kinesiology has been around for about 25 years, and really it's a combination of many. It's an eclectic approach to health.
How is it working for people? I mean, you have some great success stories?
Well, we see miracles in the practice every week, or what people would seem were miracles. Again, I tend to see patients that are other doctors' failures.
Okay. Well, thank you for coming in and telling us about this morning.
It was a pleasure to be here.
Sounds like a real interesting practice.
It is, very much.
Thank you.
Thank you.
And now let's